Surrogacy. What is it? There's gestational and traditional surrogacy. Gestational is whenever the carrier is not biologically related to the child. And traditional is whenever the father's sperm is artificially inseminated into the carrier. Each year there is about 750 babies born via surrogacy. Between 1999 and 2013, there were 13,380 deliveries. Of those, there was 18,400 babies that were born. Each state are generally favorable to surrogacy and don't really have laws that are regulating to them. There are some states that do regulate surrogacy and only allow it to be the intended parents to be a married couple. Some states forbid compensated surrogacy and only allow compassionate surrogacy. Surrogacies are generally expensive because they are having to go to doctor's appointments, the IVF treatment, and paying for a surrogate if that's their choice. These usually cost anywhere from $60,000 to $100,000. Surrogacies can be controversial and an emotional subject, so most cases will have consent on all prenatal treatment and the delivery process. The health risks that go along with surrogacy are the ones that are pretty much the same as any pregnancy, when they risk miscarriage or preterm labor. The surrogate will want to make sure that she is going to her doctor's appointments, taking her prenatal vitamins and any other medication that is prescribed, getting plenty of rest, and if she has any concerns about the pregnancy, getting a hold of her physician. Surrogacies can be emotional for the surrogate because she is carrying the baby for 9 months. Nursing interventions for a surrogate would be to have a therapeutic communication with not only the surrogate, but also the intended parents. You want to make sure that the mother knows that the baby and her will be monitored throughout the delivery, especially if there's any kinds of distress. You want to educate the mother if there is going to be any type of C-section, especially if she's never had one before. You also want to, if there is this kinds of distress, you want to let her know that she may be placed on oxygen. For resources with surrogacy, they can look up surrogacy in Arkansas and it will take them to surrogate.com, and it will let them know about finding a surrogate, becoming a surrogate, or even resources if they are a surrogate mother.